Hey guys, I wanted to give a tutorial on how to save a PowerNote as a favorite, since that's a common question, one we've been asked a few times lately. Hopefully this format helps you see it rather than having to read it. Anyway, just like any other PowerNote, of course we're going to start, after we've chosen our patient, you go to PowerNote and add a note. The first thing we'll do is you can either start with one of your current favorites and modify it, or go to your encounter pathway and we'll just start with a fresh note. In this case, I'll just type in ANES so we can get our full list of note types. In this case, I'm going to scroll down and we'll do we're going to do a regional procedure. I'll do a femoral nerve block pretend note here. So we're going to choose regional procedure, and that comes up as a completely blank note that we can modify. Because we're saving this as a favorite, we don't want to save any specific information that we don't want to change later. Specifically, we don't want to list who the provider is who's requesting it. If most of your blocks that you want to save on this one is for post-op pain, we're gonna indicate post-op pain. You can save that, but of course we would not list a provider like Dr. Moise, because the next time Dr. Bonatis asks us to do a nerve block, of course we don't want Moise's name in that, so we're going to leave that blank. Diagnosis, the same thing. You can leave that blank. Most of the time, we're going to confirm our correct patient and everything, so I'm going to mark that now. Obviously, if that changes, we need to change it in our next note. Informed consent, and usually performed by self. Site marking is almost always done beforehand. And, again, change that if it needs to. On the site, I'm not going to list it right or left because I don't know. And then I'm going to scroll down to femoral nerve. And mark it single. And preparation and take technique, I'm going to mark all my things that matter. Lidocaine, 2 mLs. So this tutorial also kind of show you some of the things that the notes can do that you may not be aware of. Lateral approach, I always do the same thing. It's an echogenic blunt needle, 50 mLs. I use stimulation and ultrasound most of the time. This is an interesting feature. If you want to put negative aspiration, you can click on it twice and it'll cross it out and it will show up as negative aspiration. Let's pretend like we use 30 mLs of 0.375% ropivacaine. This is an important thing. If you did use ultrasound, in order for us to bill, we need to click this statement. So every time you use an ultrasound, we do get a little extra bill depending on the pair, and make sure you put this. Complications, of course, unless you use a catheter, complication I'm going to put none. And then if I want to list notes, I usually list the following. No pain, paresthesia with block needle placement or injection, in divided doses or something, whatever you want to do. You click OK. Continue to scroll down. Post-procedure, I'm not going to list any of these things yet because I don't know. Again, it's a saved note, so I'm not going to list in my start times. I'm going to leave those blank. So the next thing you do to save this, you're going to go up to documentation up here, click on it, and save as a pre-completed note. You can't save directly as favorites until you go through pre-completed note, unfortunately. So I'm going to save that. And right here, I'm going to list this note title. We're going to go femoral. And in this case, I'll put test. And if you want others to be able to view it, you can save it as a shared completed note, that pre-completed note. That way, if somebody else wants to use this note, they can. And rather than hitting update existing, don't make sure you never click on update existing, because what that'll do is that'll take our current note, whatever is our saved one that everybody can grab, and it will replace it with your note. We've had that happen a few times. So save as a new note. And then you'll see our note. And then you can cancel this. We're not going to write a note on this patient. So I'm going to cancel this. We're just saving a favorite. And now, to go find your favorites, we're going to discard changes. Now we're going to go to our favorites, or to pre-completed note. And to find the latest pre-completed note, you can find the latest date, which was today. This one, anesthesia regional procedure femoral test. I'm going to click on that. and I can just add it to favorites that way. Now if I go to my favorites folder, it should be there. Anesthesia Regional Femoral Test. And the blank note should be there. Now I can change to anything I want to. I can add my times. I can change the diagnosis by clicking Show Structure and include diagnosis list. And I can add the surgeon's name and all those things. Okay? If you guys have any questions, feel free to give one of us a call. Thanks.